Now, professional whitening, dental whitening is
Professional dental whitening. Okay.
a lot of persons, even the ones I know, or some spas around, you'd see them doing whitening, which it's a good one for maybe the patients. They feel like they're paying less, but could come with a lot of detrimental effects.
Hello, viewers. This is another beautiful session of our podcast, Bellevue Dental Clinic Podcast. This is a session where we provide information to people, out there, everything that concerns their oral health, how to improve their oral health, how to take care of their mouth, their teeth, and all. If you're new to this channel, please, I need you to subscribe to this channel. If you've seen this on Instagram or Facebook, like this page and this post, and then share with your loved ones. Okay, so we are still talking about wisdom teeth, and this time around we are going deeper. And then with me today, I have a professional who is into this business, and then it's somebody that can provide us with all the information we need. So stay tuned as we talk more about wisdom teeth. So with me today is Dr. Eddy. I think I will need you to introduce yourself, please.
All right. Thank you for having me. I'm Dr. Eddy Paul, and I'm a dentist here at Bellevue Dental Clinic.
Okay. So, Dr. Eddy, before we've had like a little snippet or discussion about what wisdom teeth is and all. So, but this time around, we want to go technical about it. We want you to touch every part of it because we want our audience out there to really be informed about what wisdom teeth, what they are, and then the complications about it, because we heard that there are actually some complications, and then some people are not sure if they should go ahead to do other things. I wouldn't want to say much. I'll just start by asking you, what exactly is, or what are wisdom teeth?
Okay, wisdom teeth are said to be the third molars in the mouth. We have molars, we have premolars, we have the canines, we have the incisors.
Okay.
So the molars are the teeth we use for chewing and crushing.
Okay.
So wisdom teeth are the last molars, and they come out at the ages of about maybe 18 to 23 years. And they are termed wisdom teeth probably because they come out at that age, at the age where someone must have attained the adulthood. So they are just the last teeth in the mouth. That's the last molars, which are used sometimes for chewing. Most times, in 70% of cases, they really don't contribute to your chewing or masticatory efficiency. So that's more reason why they are prone to being extracted, because other teeth are being so we are very protective of other molars, which are very, very
useful, important
in mastication. So wisdom teeth, as I said, they are third molars, and we'll talk more about it.
Okay. So like you said, because the next question I want to ask is why they are actually called the wisdom teeth. And then while you were explaining what they are, you talked about eruption. So it baffles me that, like, at some points, like maybe a particular kind of time or your age, all your teeth gets to come out, but the wisdom teeth remains. So why are they not erupting with the other ones? Or
every tooth in the mouth has its eruption time.
Okay.
So the wisdom teeth, because there are 4 in number.
Okay, there are 4 in numbers.
There are 4 in number, yeah. It happens to be, as I said, they are the last molars, and you have molars on every part of it: the left upper, the left lower, the right upper, and the right lower.
Okay.
So there are 4 in number, 1 on each side. So the wisdom teeth happen to erupt the last. So that's why sometimes people have a lot of difficulties with wisdom teeth, because maybe because after all the teeth must have taken their spaces in the mouth, the wisdom teeth may not have the space to come out. So that's why it comes with a lot of difficulties and problems which they have to be addressed by the dentist at some point.
Okay. Yeah. So how do we know that we might have complications in the future, or how do we know that we need to probably extract, or I don't know, just to prevent problems?
Yeah. Now there are 2 schools of thought about wisdom teeth.
Okay.
Some people, I would call that the archaic or probably the obsolete school of thought. Some people believe that at 18, anybody must attain the age of 18 before you think of extracting a wisdom tooth. Okay. Why? They feel that at 18, you would probably know if a tooth is erupted, or if the tooth will be erupted at a particular point, or the tooth probably may not erupt at all.
Okay.
But the new school of thought now does not have to wait till 18 years. That's the more advanced, or how do I put it down? The contemporary school of thought that believes that at age 12 or 13, you can use technological devices like the new the panoramic X-rays and maybe some CT scan to foresee. A good dentist will be able to foresee at this stage if a tooth will probably erupt at 18. Mm-hmm. In that case, you prevent the complications of extraction when the roots are long, because at 18, the roots are already formed up to the extent whereby extraction may be a bit more complicated than it would have been at the age of 13 or 14. Yeah. So we always advise people to, if possible, see a dentist, and a dentist that believes in the advanced method, because some of them will tell you to wait till when it's 18, which could bring more complications. Now that would enable the dentist to look at the X-ray or to do the necessary investigations and end up and let you know if your tooth would probably erupt at that age, or if there are going to be difficulty with spacing. If there's a difficulty with spacing, you would know at such point, and you could opt for an eruption at the age of 12, 13 to 14. And that has a term called gemectomy, which is gemectomy. Yeah, gemectomy, G-R-M-E-C-T-O-M-Y. Okay. And that is specially done for wisdom teeth.
Okay, so that brings me to my next question, which is why we should extract our wisdom teeth. So it means that when we are at that age, or when our kids rather are at that age, like 13, 14, we should be conscious about how their wisdom teeth will erupt.
It's hard for parents to know themselves, so it's always.
So I mean, like, to bring them to a dentist now. So we should be conscious, and then we know that we have to take them to a dentist.
Even before then, that's the age. I told you that it's the age they should be extracted.
Okay.
If, they foresee that there are going to be issues in the future. Now, you should take your child to the dentist even as early as possible. There is no...
Like what age?
I mean, at 3 years, you can just take your child to the dentist to have a look at the teeth. I mean, they probably may not do anything, but at some point, if there's anything seen at that age, it could be corrected easily than at an older age. So it's always advised to take your child to the dentist as early as you can.
Okay.
Yeah.
So Dr. Eddy, please, can you maybe give us maybe a very short list of a few reasons why we should extract our wisdom teeth?
Okay. Now, when a tooth is impacted, let me talk about the classification of impaction first. We have what they call soft tissue impaction and the hard tissue impaction.
Soft tissue impaction and then hard tissue impaction. Okay.
Now, soft tissue means that, as the name implies, soft. The gum is restraining the tooth from coming out.
Okay.
I'm just trying to use this as simple.
Yes. You should because yes.
Now, the gum is restraining the tooth from coming out. Now, hard tissue impaction means the hard tissue, which is the bone, is restraining the tooth from coming out.
Wow.
Now, a tooth can be impacted by soft tissue because probably the fact soft tissue is very fibrous. Fibrous means it's hard in nature. So in that case, you probably don't need an extraction. They may do what they call operculectomy. Operculectomy is the removal of the gum around that area to allow this tooth to erupt. Hard tissue impaction most times would need extraction. It could be partial impaction, it could be full impaction. Partial impaction means if you look into the mouth, you can see part of the tooth in the mouth, parts buried in the bone. Full impaction is a case where you don't have to see, you may not see anything in the mouth. That means the tooth is totally buried in the bone.
So you use the X-ray to...
Yes, you use the X-ray to maybe have to get to your, or make your, how do I, like, you can see it in the mouth on your own, but you can still use your X-ray to determine the level. For example, the X-ray is really helpful when you want to differentiate between the soft tissue and the hard tissue. If you look into the mouth, if it's soft tissue impaction, you won't see anything, same as hard tissue impaction. But the X-ray will tell you the level of the bone, that the bone is at a particular level, and the tooth has come out from the bone, that is just the soft tissue that is impeding its eruption.
It's from erupting fully. Yeah.
So it depends on the approach. Now, there are other
reasons.
I'm just trying to, that's just one side of the classification.
Yeah.
There is other one we tell you about the mesioangular, which they talk about how it's situated in the bone. could be mesioangular. Mesioangular means it's leaning to the tooth in front. Distoangular means it's leaning to the tooth vertical and all that. That's a bit more technical. But if you want me to go deep, I can still talk about that. Now, that would help the dentist to know the difficulty, call it the difficulty index, how difficult this tooth would be, the extraction process would be. So that's why we always do an investigation, look at the x-ray properly, and come down with a decision. Some tooths, we advise people not to extract. Others, we just, would advise you, to go ahead with the extraction.
To extract them. Okay. So this extraction process, is it painful? Is it a painful process?
Now, people always run away from dentists. They think that dental procedures are painful.
There's when we see the needles and then the other things.
Come on, there are needles everywhere. Even the medical world, you still have to deal with needles at times. So now, all procedures that we know would be painful are done under local anesthesia.
Okay.
Some could be general anesthesia. Now, we wouldn't do any procedure that we know would be painful without giving an anesthesia. Okay. I always tell people that go for extractions when they get scared about extracting a tooth that we make sure you feel no pain before we do anything, because it's stressful to the patient and the dentist to extract a tooth when the person is in pain. So we always make sure if the area is fully anesthetized before we go ahead with any form of procedure that we feel may be painful. And so this is to tell you that all procedures in the dental clinic are painless. So because if we know that it's going to be painful, we first of all have to anesthetize the area and make sure we don't feel any form of pain before we go ahead with such procedures.
Okay. So, Dr. Eddy, with all you've said so far now, that means you're saying it's advisable to extract your wisdom tooth,
yes,
or teeth.
Now, there are, as I said earlier, we sometimes we look at it is impacted and we tell you not to extract. Now, there are symptoms and signs that come with wisdom teeth. People present, some people don't even know that they have impacted wisdom teeth. It's sometimes when you take an x-ray, you tell the person, oh, this tooth is impacted, they will be shocked that they have a tooth in the bone. Now, there are signs and symptoms. Some patients would present to the clinic and because of maybe pain.
Okay.
It could a wisdom tooth that is not properly erupted, or probably there is no space for it to erupt, can come down. The patient can come down with severe pain. Some can come down with inflammation of the gum around the area. Some can come down with bad breath because
breath.
Yeah. If it's partially erupted, like I said, I told you about partial impaction.
Yes.
If part of it is in the mouth and part is in the bone, food can pack there, and when that food decays around the area, it can give serious bad breath. So it can come down. The patient can come down with bad breath. It's one of the
the causes.
Signs of wisdom tooth or what wisdom tooth can cause, in like some symptoms that patients would come down with. Mm-hmm. Also, you can have caries, decay on the other teeth. Now, if a wisdom tooth is pressing on the next tooth and food stays there, as I said, it can cause a decay on that tooth because the patient may not be able to clean that place properly. So it can destroy the tooth next to it. Now, it's always advised to go for a consultation and probably take an x-ray to know the situation of your wisdom teeth.
Okay.
There are some that will stay in the bone without causing any form of pain or any form of symptoms to the patient. But after we've taken an x-ray, we may advise you to extract them because there are complications that could come in the future as a result of wisdom teeth. For example, wisdom teeth can be present in the mouth, and let's assume the patient did not even know that he had a wisdom tooth. Yeah. Now, after an x-ray, we probably would see a wisdom tooth in the mouth, and you advise the patient accordingly because the wisdom tooth can lead to what we call cysts.
Cyst.
A cyst is it's just a fluid-filled cavity that is in the mouth. Now, why it's a developmental issue? Now, these cysts can lead to tumors in the mouth that can keep destroying the bone around the wisdom tooth area.
Wow.
So that's why it's always advised, if you have a wisdom tooth in the mouth, it's advised to go and see a dentist, and a dentist would advise you accordingly. And some cases where they see the complication of extraction may be so bad that it could lead to other complications, we can be advised to leave alone. But if it's something that it can be extracted, it's always advised to take them out.
So sorry, Dr. Eddy, sorry, this cyst area actually caught my attention a lot. So you're saying that some of these wisdom teeth, when they actually not really, maybe you don't know, you've not gone to see a dentist, and then it's not in a good position, cysts can develop around it.
Now, there's a sac. It's like a sac, just like a sac, and water within it. A cyst is a fluid-filled cavity.
Okay.
That is most times found in the bone. Now, this sac develop around the tooth area.
Okay.
I don't want to go too medical. I'm trying to break it down as good as possible. Now, this sac, the lining of the sac, if it stays in the mouth or in the bone for a very long time, can transform the lining to a tumor. The lining can transform to a tumor. And a cyst is continuously increasing in size. As I said, it's a fluid-filled cavity. Osmosis will tell you that water will always come into, osmosis, the movements of water from the region of lower concentration to high concentration. When it's in the cyst area, it's a bit highly concentrated. So water will always come in and expand the cyst size. So the cyst will continually grow.
Affect the bone.
Yeah, and keep eroding the bone and destroying the bone. If it transforms the epithelial cells, that's the lining, transform to tumor, it could cause more destruction of the bone around the jaw. So, which is more reason why a dentist is, at the best position to advise you if to extract a wisdom tooth or to leave it alone. Sometimes why we leave it alone is because when we see that there's no how you would take out a tooth totally without destroying a greater amount of the bone. We look at, imagine a tooth that is impacted from the lower border of the jaw up till the upper border of the jaw, if that is possible. Now, if you take out that tooth, that place will have a big void, which could need a lot of packing. You can tell the patient not to eat hard food. But that is in very rare cases. That's why it's always advised to see the dentist, and the dentist will advise you accordingly on which route to take. Yeah.
Okay. But so, Dr. Eddy, is it possible for people to erupt all four of their wisdom teeth without any complication, and then there will be space for them to come out?
There are some people, that's why when you go to meet an orthodontist, they will tell you, okay, you have spaces or you need space. People have a lot of spaces in between their teeth. It's just the origin of why teeth are impacted is that the spaces in the mouth, the space in the mouth is too small for the teeth that are erupting. So if you have, maybe your mother had big teeth and your father had, a small bone. So imagine you inherit the big teeth from your mom and the
small bone from your dad. Yeah.
You see that at age 12, where you are erupting the second molar, all the space must have been taken up. So there will be no space for the last tooth to erupt into the space, which would lead to impaction. So some people, it's the other way around. They have more bone space. The bones the jaws are wider,
bigger, than the teeth are smaller.
So in that case, the speech would be an issue, because when they make pronunciation, you get to hear some escaping sounds from the teeth, which an orthodontist is what they will require at that point to close up the spaces and give them the normal oral health that is required.
Wow. Yeah. Really, Dr. Eddy, thank you so much for all your answers so far. They've actually really been very, very excellent. Yes, I'll say that. So we are moving to the next topic, and this is where we want to discuss. Want you to tell us a little bit about teeth whitening. So now everything is trending. Whatever is trending, people want to just dive in. So when we were young, me and my friends, we thought our teeth were not appearing well, or we didn't really like it. So we decided to brighten our smile, or should I say make our teeth whiter. We went ahead to get baking soda, charcoal. So it was really bad because all of my teeth became very sensitive. That's the word. And finally, my dad had to take me to a dentist, and then he explained that I actually wore or eroded off my enamel and all, So then he told me that I don't even need a whitening at that time, So I started to think about it, because if by my actions, I'm eroding my enamel, and then I hear people going for whitening because I hear they use chemicals also on the enamel. Is it not the same thing? Like, what's like the difference? So I wonder, is whitening actually even safe, or should I just go ahead to do whitening without maybe seeing a dentist, or should I do a consultation first? You know, all these things are some of the things that are bothering me, and I feel people out there would want to get to know more about. So I don't know if you would want to speak a little bit about whitening.
Okay. Now, professional whitening, dental whitening is
Professional dental whitening. Okay.
you know, a lot of persons, even the ones I know, or some spas around, you'd see them doing whitening, which it's a good one for maybe the patients. They feel like they're paying less, but could come with a lot of detrimental effects. Now, whitening is not meant for everybody. So, first of all, it's advised to see a dentist, and a dentist would consult you. There are some cases where we tell patients you don't need dental whitening. There may be other options for the patient regarding the case, because every case is peculiar. You don't expect what works for A to work for B.
Okay.
So, whitening is the act of using you use chemical. I don't want to use the word chemicals anyway. So for maybe for the layman, you can just say chemicals to brighten the color of the teeth. Just think about bleaching. Let's use the word bleaching.
Bleaching. Okay.
So bleaching is another word for whitening. So bleaching is just like bleaching your teeth to make it, the color lighter. Now, if you see a dentist and you meet a dentist for dental whitening, a dentist will be able to control at which point he or she should stop the process, because dental whitening can be detrimental to the health of the tooth. Now, imagine whitening, bleaching your teeth up to the point whereby the nerves or the live tissue of the tooth, which is the pulp, is affected by the whitening paste. It could destroy your teeth at the same time. Now, that's why we always tell our patients that we control our whitening. May not be as white as this wall. We always tell them that it's controlled. If you need a kind of teeth that is as bright as, let's say, this wall, now we can advise you to go for veneers. We see a lot of things online. You could see people with very bright teeth. You don't know they've probably done veneers and they're doing adverts for dental whitening. Imagine your tooth color is close to black and you want it to be white. It's almost impossible. For people that have teeth color that are close to white, maybe they could get such color. So it depends on the people. There are people that have inborn metabolism error during when they were given birth to. I had kids, friends in school that they used to mock at them that they had brown teeth. Those kind of people don't need whitening. No matter how you try to brighten their teeth, it won't get to the level they would want. So those are the kind of people that go for veneers. So it's always advised to see a dentist. Whitening is safe if it's done by a professional, but it could be very disastrous if it's done for someone that is not professional.
Okay, or done for someone who doesn't need whitening.
Yeah, some people don't even need it actually, because imagine you mentioned using charcoal.
Yes.
The difference with whitening and charcoal is, imagine there's abrasive effect. The charcoal has abrasive effect on the tooth. Now, if you put something like baking soda that has chemical, it can make, I don't want to use the word soften the tooth, can open the pores of the tooth, and you use charcoal to scrub it, it can cause serious abrasion on the dentine, which will expose, on the enamel, and that would expose the dentine, which is the sensitive part, and you have sensitivity of the teeth. So what whitening does is to open the pores of the enamel. The enamel has pores, small, tiny holes, where it opens and goes into the dentine and brightens the dentine. The color of the enamel is translucent. It's a see-through color.
Okay.
The color that determines your tooth is the dentine. So it goes to the dentine and brightens the dentine. So if there's a lot of this chemical, as you call it, goes into the dentine, and the dentine, is sensitive.
Yes.
It could cause sensitivity. So one drawback for whitening is hypersensitivity. People can come down with serious hypersensitivity. So when it's controlled, the dentist would know when to stop. You can, divide the sessions into maybe 5-6 sessions to make sure the patient gets at least, an appreciable amount of whitening, but without destroying the tooth tissue.
Or without them coming down with serious sensitivity and wow. So the best bet is to see a dentist before you go ahead with your teeth whitening. So while you were explaining that, you talked about veneers, but Dr. Eddy, really, from what we get to see online for the range, like the ranges for the price for veneers, actually, it's actually very, very expensive. I don't think most people can afford that. Do we have like a substitute for it, or
yes, we
something
do.
quite affordable?
Yes, we do. Now we have what we call porcelain veneers. Now those ones are a bit more pricey, but we have the composite veneers. A lot of dentists don't like to do that because the task in it's a bit enormous compared to the porcelain veneers, where you just have to prepare the tooth, take the measurement, and send them to the lab. The lab guy is one that would prepare everything, and they send it to the lab. You cement them to the.
That's for the porcelain veneers. Okay.
But composite veneers, you still have to select cases where you have to do composite veneers for. For people that can't afford porcelain veneers and they want to do composite veneers, you would have to look at it as a dentist and know if a composite veneers would be suitable for such a person. But that one is way a little cheaper than the porcelain veneers.
Okay.
Yeah. So if you are bothered about the amount, maybe you can see your dentist and find out if composite veneers would be good for you. And that could just be.
What about the results? Like, can we compare the results?
Okay.
Can we say composite is quite satisfying also?
Of course, compared to what, let's assume a patient that came in with maybe a fluorosis or tetracycline stents, you would definitely expect a better quality of the work. I don't know how to put it. Of the results. After everything has been done, you can't even compare with what the person came in with.
That's with composite veneers.
With composite veneers, but the porcelain veneers are still best because this is done in the lab. The actual color you want can actually be. But in composite veneers, you are limited to the color of the composite, which composite is meant to fill the tooth or make veneers, as we said.
Okay.
But it's not expected to bright. The aim of doing veneers is not for you to have teeth that are white, paper white in color.
Wait,
that's not
the aim of what's composite veneers.
The aim of veneers
okay.
is not to have paper white teeth. But people nowadays ask for paper white teeth.
Okay.
And this can only be achieved by veneers. Now, but in composites, you can't have paper white composites, and it doesn't look natural if you ask me. So we always advise our patients sometimes, because everybody wants white teeth, but we always tell them, why not try this shade? This shade could be the best for you. But most times when they finish, they get very excited because imagine having paper white teeth. When you open your teeth, everybody would know that you've worked on your teeth, and it probably may not look so natural. So it's best. Some dentists will tell you the best route to take, and it's always advised to see a good dentist.
Are there should I say instructions to follow, or what are like the ways to take care of your teeth when you've probably done this composite veneers? Do you have to be careful of a lot of things, or you can just start living normal?
Yeah, it's just like having crowns on. It's composite veneers. Sometimes you have limitation in biting with your front teeth. We'll just tell you don't bite hard. You don't bite hard things with your front teeth because it may. When I said may, anything can happen. It could crack. So same applies for porcelain veneers. There are some limitations, and it can be like even the one God gave us sometimes.
Natural.
It cracks. So that's what could crack at some point. So, and then we always tell them, especially for composite veneers, the first 2 days you're not expected to take anything that is oily, and you don't smoke, because cigarette stains can really affect the quality of the teeth. So there are some minor that are doable instructions that always. Almost every procedure has instructions attached to them. So that's that.
Okay, yeah, thank you. It's a wrap. You got it from a professional himself. And see you soon on our next episode. Thank you.
All right. That's it. Bye.